GlobeMed at Berkeley has been my project, my community, and the core of my undergraduate years. But to tell you my GlobeMed story, I have to start far before GlobeMed actually became a part of my life. Days after my sophomore year of high school ended, I was gearing up for my first internship at Thulikel Hospital, a community-based hospital in Nepal, where my family is from. It was on one of those evenings that summer that I got a call from my dad's close friend. He told me that my dad had fainted on the tennis court, that I had to come to the hospital right away. My heart pounding, I held my younger brother in the backseat of the car. It wasn't until I entered through the corridors of that hospital and I saw my dad with my own eyes that I finally began to cry, harder than I've ever cried before. It wasn't a cry that came out of sadness or memories with my dad, not yet. It was a cry that came viscerally, which outstretched the boundaries of emotion. It was a reaction, an instinct over which I had no control. And it was only 3 weeks later in the emergency room of Thulikel Hospital that I saw that exact same reaction on the faces of Sushila's family, as they learned that their wife, mother, or grandmother had just passed away of heart failure, just what my dad had died of. She had severe chronic obstructive pulmonary disorder, which the doctors explained had been caused by years of her cooking indoors without proper ventilation. This is an issue that's common in Nepal. My dad's heart failure, as the doctors told us, had been caused by his smoking habit, as well as stress and high blood pressure, symptoms common amongst Americans, especially those whose societal status requires them to work harder to achieve the same merits as the rest. I began to connect all of these dots, and I realized that there were forces beyond Sushila or my dad's control that caused their hearts to fail. Sushila had been left without access to healthcare in a world with so much innovation. She had likely received little or no education from an undervalued school system that didn't bother to teach about the effects of fumes on health, or certainly at that time, empower women to lead society forward. And she had been subjected to poverty by the decrees and wars of rulers who for centuries valued and still value power over people. My dad, like many who come to this country as immigrants, was a person who would go to incredible lengths to provide for his family. Working overtime, taking extra projects, and even sacrificing time with his own family were things that he was willing to do to give his children the opportunity to achieve things that maybe he never could. But the stress of work eventually took a toll on him, as did the greediness of corporations who prioritized profits over the livelihoods of people for years to sell and addict the masses to tobacco. So, was it really just their own hearts that failed them? The answer, as I've learned over the last 6 years, is no. It was the systems of oppression created over centuries by our global society that had failed them. But during my first internship in Nepal, I discovered that there were people who were trying to shift that paradigm. And some of them were a few flights of stairs below me in the Department of Community Health. Over the next few summers, I became close with the people in that department. I went to community outreach centers all over Nepal, and I got to participate in programs and research. And I even taught a workshop in schools about the health effects of smoking. One day, over a lunchtime conversation, I learned that an international organization working in one of our outreach communities had built latrines to combat hygiene and sanitation in the village community we were working in. And this all sounds great, right? But the problem is it was a year later now, and the organization had left to go save lives elsewhere in the best way that they knew how. But what did we find inside these carefully constructed latrines? Just bags and bags of rice. It was through lessons like these that I learned the importance of handing tools and agency over to the community to affect meaningful impact in public health. I took these exact lessons with me to college in the first week of my freshman year. I had heard about this organization called GlobeMed from my friend Neha at UCLA, and I was sure that there would be something just like that for me at Berkeley. But there wasn't. So, being the stubborn person I am, I decided I had to start a chapter of GlobeMed at UC Berkeley. It started with a passionate email about why GlobeMed should consider my founding application, even though that year they were only accepting applications from HBCUs and LSIs, which Berkeley is not. When I was writing this, I actually looked back at the email that I sent them to try to gain some substance and maybe include some of that in my speech, but it was so messed up and scatterbrained that I could barely even understand it myself. So I'm really surprised that I even got past that step. But I spent that winter break writing and refining my best application, and I finally submitted it, ready to wait anxiously for a long time. The response came the next morning. Turns out 2 former GlobeMed staff, Brittany and Alexis, were in San Francisco and invited me to interview Thursday, the next day. So, in between classes that Thursday, freshman me ran over from Berkeley in my wrinkly suit and stained running shoes to a cafe in San Francisco's Mission District, where Brittany and Alexis sat, looking menacing as ever. Honestly, I can't remember much of the interview, but what I do remember is that I had a horrible hacking cough that week. And I had this incredibly irrational fear that since GlobeMed was a public health organization, if I came into an interview with a cough spreading disease, I was definitely going to get rejected. So I spent the entire interview for that entire hour just holding in my cough the best that I could. And to this day, I still wonder if Brittany and Alexis ever caught on to that. I'm going to ask her after this. Later that month, I found out that I would become the founder of GlobeMed at Berkeley. Amidst the webinars and reading material, I began creating an executive board application and drafting the constitution of my dreams. I spread the word around Berkeley by sneaking GlobeMed into conversations and posting things on Facebook. It wasn't long before applications came in, about 25 of them, for an e-board of 8. And those 25 applications meant 50 hours of reading, interviews, and deliberations for me right before finals. But through that process, GlobeMed at Berkeley was gifted with the most talented, visionary, and intelligent first 8 members that I could have possibly imagined. I owe all the credit to them for creating the foundations to such a strong chapter. That summer, the 8 of us, but especially my first co-president, Catherine, and I, took that draft constitution and completely reconstructed it. We thought about stability, creating a tiered co-president system such that each outgoing president leaves with confidence, knowing that their counterpart will train the next generation. We thought about equity, creating a due system that distributes resources to those in our club who need it the most. And we thought about longevity, creating an inclusive but rigorous admissions process to ensure that we had member retention. And let me make it clear that not everything in our original constitution has worked out. We have made many amendments, and we do not have 100% member retention. But the framework of our Constitution, the dynamism of our student leaders, and the unwavering support from all of you, the GlobeMed community, has guided us along the way. From the optimism and excitement our first e-board felt when we partnered with Tulika Hospital and received our first batch of applicants, to the smiles, fervidity, and teary eyes during GHUs about our personal stories, urban housing, or immigration, to the hope I feel after each new GROW team is recruited, e-board appointed, and president-elected, GlobeMed has been the one true defining experience in my college years. So, as I lift the weight of GlobeMed at Berkeley off of my shoulders, and trust me, it was a very massive weight, I feel safe knowing that it's held sturdily on the shoulders of all of you in the GlobeMed community, the dedicated members and alumni of my chapter who sit right here in California and across the United States, and the people at Tulika Hospital who continue to be patient despite our cyclic nature as a student org, clumsily having to relearn how global health works over and over again. Last, I'd like to think that GlobeMed, at its core, is about people and their stories. These people, like Sushila, who developed a disease due to a negligent system, like the millions who live in poverty across the world and right here in the United States, and like my dad, are more than just mortality rates and disease incidences by nation. They are people with lives and stories who need justice from a number of systems that have kept them in the shadows of statistics for too many years. GlobeMed exposes students to these truths and ignites passion within us to help serve the dismantling of these systems now and in our future careers. I feel that passion in my chapter. I felt it in all of you who I've had the privilege to meet this past weekend and in past GlobeMed events. And I thank GlobeMed for giving me the opportunity to ignite that passion within myself. Thank you.